Hi, I'm Heidi Otway, your host for this Conversations on Cannabis virtual forum brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. In this conversation, we're talking about medical cannabis as a treatment for autism. So let's talk and learn about this subject with our guest. Dr. David Berger is a board-certified pediatrician with more than 2 decades of experience. He founded Holistic Pediatrics and Family Care, one of the few medical practices in Florida that certifies children to use medical cannabis. Dr. David has gained a national reputation for his expertise in holistic pediatric primary care with specialties in nutritional and lifestyle therapies for autism, ADHD, and related disorders. Dr. David, it's good to have you back on the forum.
It's so good to be back. It's good to see you.
Good. To everyone joining us on this live program, please share, post, and tag a friend on Facebook to have them join this conversation. If you're on YouTube, share the link so others can join us as well. During the forum, we want you to send us your questions in the comment box, and we'll do our best to have our guests to answer them. We also want you to tell us what you think about this forum by completing the survey that will be posted in the comments on YouTube and Facebook after the live program. Your name will be entered into a drawing on May 7th, 2024 to win a $100 gift card provided by one of Mary's partners. Now, let's start this conversation on cannabis. So, Dr. Berger, let's just educate our viewers and listeners. And can you explain to them, what is autism?
Sure. And the term autism spectrum disorder is really the way I like to think of it, because it really is a spectrum. So, anybody who has a diagnosis of autism, there is some level of difficulty when it comes to communication. Sometimes it may not be in spoken word. It could be the ability to read body language or to understand things. With behavioral issues, sometimes it can be irritable behaviors, attention focusing type of issues, anxiety issues, etc., OCDs. And then also some level of social, whether it's some could be socially afraid to do things or don't interact with people or may not share affection with others the way they do. So, but there can be a very wide spectrum. There are people who you probably know who would qualify for level 1 autism, but you wouldn't know it. But obviously a level 3 autism is somebody that most people would recognize. And so everybody's different, everybody's unique. And the term neurodiversity, which is a term that we are now using a lot more of, I really appreciate that as well. People were using the word neurodivergent, but that's kind of a negative term. The diversity, diversity is important in all parts of life, all parts of society. And that's true certainly when it comes to people's development and function as well.
So am I hearing you say that we're trying to move away from the term autism to neurodiversity?
No, just it's kind of a word that people are using, but also neurodiversity could be people with Tourette syndrome or people with ADHD or other types of movement disorders in the neurological behavioral realm. So autism spectrum disorder is kind of like the biggest part of that, but it's still kind of like you'd see if autism is kind of like a subset of the grander neurodiversity.
Okay, very interesting. Thank you for sharing that information. So can you tell us, how is autism commonly treated?
So the most common way is through education and therapy. So most people with autism have to be in special classrooms, or if they're able to be if they are higher functioning, they work with an aide within the classroom. Some will get pulled for certain subjects. But people who have more advanced autism may need to be in a special classroom all the time. The most common type of treatment is called applied behavioral analysis, or ABA. And then from a medicinal perspective, there is only one approved medication, and that's for the irritability of people with autism. There's 2 medications, Risperidol and Abilify, which are antipsychotic medications, but there really is no other pharmaceuticals. A lot are used off-label. If a person with autism has anxiety, then of course anxiety medicines are used. If many of them do have ADHD, so the ADHD medicines can be used. But there's for actual autism, that's the only that's FDA approved would be those antipsychotic medications.
Wow, that's interesting. So why should someone consider using cannabis as a treatment for autism?
Yeah. So with a basic understanding of, first of all, of our endocannabinoid system, So people should understand that we all have cannabinoid receptors on almost every cell of our body, and we make cannabinoids. We don't make THC and CBD. There's one called 2-AG and one called anandamide. And the role of the endocannabinoid system is to maintain balance, homeostasis. So if one cell is overstimulating another cell, the second cell sends a message back to the first cell that basically says chill. And
Mm.
so that happens every moment of our lives. But
Oh.
some people, the regulation could still be off. And so the plant-based cannabinoids, CBD, one of its main features is it keeps our cannabinoids around longer, the ones that we make. And in fact, people with autism back in 2019 were found to have lower levels of those naturally produced endocannabinoids compared to people who did not have autism. So in people with autism, there does seem to be a true deficiency of endocannabinoids. So if
Mhm.
CBD keeps that around longer, then that could be fixing that deficiency. THC, on the other hand, it primarily works directly on that same receptor in a stronger way than our endocannabinoids do. So
Mhm.
again, it's kind of like not directly fixing the human-made cannabinoids, but it's stimulating the same receptors, and that's how it does seem to work on the chemical level. Now, in terms of like the things that we see it help, though, it's I'd probably say anxiety and irritable behaviors and sleep are probably the three most common improvements that I see. A lot of people with autism, especially once puberty hit, they're very commonly can develop seizures, and we know cannabis can be very helpful for that. But I've seen kids pay attention better. I've seen kids, understand things better, follow tasks better, and some kids do communicate better.
Wow. Well, recently I saw a news article in the Tampa Bay area where you were featured for having cared for a young man with autism using medical cannabis. Can you share a little bit more about that experience and the outcomes of that treatment
Yeah,
you
yeah,
provided?
and he had been somebody who I'd been seeing since for way over a decade, probably closer to 15 years, I'm gonna guess. And as time went on, really anxiety became the most challenging thing for him. The thing that was really holding him back, and that and his OCDs. Okay, and
Okay.
they got some run in similar circles. And he just had a remarkable response to cannabis, both CBD and THC, and his just ability to function in the world, the ability to function at home, ability to function with school, it just significantly improved. I mean, and the beautiful thing about that is that it improved the lives of the parents. Because when you have a kid who's better functioning, better behaving, then it takes a lot of the load off of the parents that they don't have to be on guard all as much, or when's the next shoe gonna fall? And so, that's another quote unquote side effect of medical cannabis and autism is it's brings more peace in the household.
So, if parents are listening, or even adult who has been diagnosed with autism, what are the steps that they would need to take to determine if cannabis could be a treatment for them, medical cannabis here in Florida?
Certainly. So it goes by what we call the qualifying diagnosis. So autism itself was not one of the 10 that we had originally voted on, but there was another section of the law that says, or other similarly debilitating conditions to the ones that were actually listed. So, for
Mhm.
instance, a person with autism may have irritability or OCD or anxiety or insomnia similar to a person with PTSD. So we
Oh.
say that a person with autism suffers in a similar way for those particular symptoms for a person with PTSD. A
Mhm.
person with Parkinson's syndrome, for instance, may have an inability to speak. Now, it's a very different reason why they can't speak, but still, it's not more or less debilitating to the individual. If you can't speak, you can't speak. So,
Right.
for people who have a more speech issue, we're more likely we'll say, well, this has a similarly debilitating condition to Parkinson's, etc.
That's interesting. So they would would they go to the office, Florida Department of Health Office of Medical Marijuana Use, to go through a process to legally get a card, or should they
Yeah,
go to
so
their primary
they have to.
care?
They have to be seen by a physician who's been certified by the state to do it.
Yeah.
So,
Mhm.
any physician can do it. A lot of haven't, but so that's the
Mhm.
first thing. So, like when they come to my office, there's one of two things that happen. Now, most kids, well, every kid with autism has a diagnosis before they walk in. right?
Mhm.
Because
Right,
because now they're coming to me for treatment of a known condition. So
right.
as long as I have documentation, whether it was from their pediatrician,
Mm,
obviously I see these patients myself, so I know that they do.
yeah,
But whether it's from a developmental pediatrician, a psychiatrist, psychologist, or neurologist, once I have documentation, medical documentation that they have the diagnosis, then that obviously clarifies that. And
yeah,
so then there are several different additional steps. There's an informed consent form that has to be signed every single time.
yeah,
There's certain attestations that they have to make, such as they're not pregnant, which is great when you're asking a mother of a 4-year-old boy if their 4-year-old boy is pregnant, but we have to do that too. So we kind of make a little chuckle out of that one.
yeah, that's funny.
Yeah. And so there's these certain amount of things that we just have to document in the chart that we've
Yeah,
discussed other options, etc. And then in any child, so anybody under the age of 18, besides having the physician, the certifying physician, then going ahead and doing all that, every child also has to have a second physician who attests that the benefits outweigh the risks for that particular patient. So I also serve for as that second doctor for a
mhm,
lot of doctors around the state who want to have
mhm,
a pediatrician kind of backup.
yeah,
If they may not be a pediatrician themselves, but even if they are, they're actually that second doctor on there. So I have two other physicians that work in my office here, and so the three of us
mhm,
cover for each other.
yeah. You kinda touched on, the risk. What are the risk of someone with autism using medical cannabis?
Okay. Well, there are a very small percentage of kids, first of all, don't do better. Okay. I've seen kids get more irritable.
Mm,
Sometimes they lack focus. And so that's obviously the first thing. So, as a doctor who practices functional medicine, to me, I love that word because at the end of the day, how are you functioning? Are you functioning better? Are you functioning worse? And it's such a clarity of a term that it makes parents be able to recognize that. So, there
mhm,
may be some times where yes, cannabis can cause the munchies. And so, I've had some parents be like, well, I really have to keep a lock on the refrigerator now or something like that. And some kids, and it's interesting when it comes to attention and focus. Because most people, when they think of marijuana, they think of like a space cadet or someone zoning out. And so for me to have patients who tell me that they're getting their kid off of Ritalin or off of Prozac or other things, that we have that all the time. In fact, in my experience, the most common side effect for cannabis is reduction of other medications. So not all side effects are bad.
interesting.
But so those things, but we check that. But also a very big part of what I do in my education is we start super low. And I always recommend starting with CBD first, which of course doesn't have the intoxicating abilities of THC.
Right,
And
right.
we work that up and then bring the THC in secondary while the CBD's there, because a lot of people don't realize that CBD can blunt or can even stop the intoxicating effects of THC while the other benefits are there. One could
Mhm,
even use CBD as an antidote to THC if they took too much THC. So that's in that stepwise fashion and taking it very slow jumping. We don't ever see patients who just go off the walls, because if you're taking the slow approach up, if you start somebody on a high dose, God knows what's going to happen. But if
right.
you start at this low dose and you give them 3 or 4 days to assess, and then, I recommend all parents keep a spreadsheet or a log so that they remember, because maybe it turns out that what they were taking a couple weeks before was actually the best combination for them. But I
Yeah.
also recommend making one change at a time. So like, don't increase the CBD and the THC at the same time. Choose one.
Mhm. So how are these, young people, children consuming the cannabis?
So by far the most common way is oral. They do make capsules, drops, edibles like gummies.
Mhm.
Um, there are patches that are available that can be particularly effective during school or during long therapy sessions, because it does what we call micro dosing, the release of a small amount on an ongoing basis, an amount that wouldn't cause a person to be high anyway, but they kind of get the steady and it lasts all day long. Because one of the issues is that most schools, you're not allowed to, you can't just leave it with the school nurse for them to administer it. The parent has to come
Mm,
on property, which many can't. So a lot of times we have issues where, hey, we have a great morning, but the afternoon is not so much. So a patch can be very helpful there. But I
mhm.
do have kids who inhale. Flower itself is not legal until 18.
Okay.
But I do have people who do use vape cartridges, and the beauty of that is the instantaneousness. So I have most of the families will use oral kind of as like a baseline, kind of start the day out, everything, but we'll also use the inhaled versions in that hey, in case of emergency, break class, I could see my kids getting irritable, or hey, we have to make a stop at a store after school or therapy we weren't expecting, and my kid doesn't do well with change and likes the routine, so they can give them, if we have to make a change, we can give them a couple of puffs and change of plans, and they handle it better. So, but by far the most common way is oral.
And just to clarify, children cannot smoke cannabis in
Right,
Florida.
they're not. They're until the day you turn 18. It's grayed out in the registry when we put the patients into the registry through orders. There's no mechanism that you can accomplish that.
Yeah. You touched on the part about the schools. I just find that so fascinating that, there's laws that say the schools have to allow it, and there are, different restrictions just to ensure that the child is getting the cannabis and no one else. Can you talk a little bit about that, just to educate some of our parents that may be listening on what that process could potentially be?
Yeah, and part of the issue is that the only person who can administer cannabis to a child is a caregiver who has a card. Okay. So that makes it, obviously a nurse can't go out and get 37 cards for, for each patient. And, and you're only allowed to have 2 caregivers. Right. So so part of the law just kind of prohibits that. Okay. Now, prior to COVID, so that would have been like that fall of into the winter of 2019, there was actually a mandate for schools all school systems to submit a plan that would allow for it to be done. But then when the pandemic hit and obviously everything else shut down, and
Mhm.
fully understand why departments of education and departments of health would be like, hey, we kind of have some bigger things we got to take care of right now. And so it kind of went by the wayside, and it unfortunately never resumed. So we never got the completion on it.
That's so interesting. So, what's the latest research on cannabis as a treatment for autism?
Yeah, so at the end of 2023, this was at a study out of Brazil in Frontiers in Psychiatry. It was really fascinating. So it wasn't a double-blinded placebo-controlled study, which of course those are the best, and it had 20 subjects in it. And of course, you like to see a larger study. But what they did is, and what I really appreciate is they did in this study, and it's the only time I've ever seen this in a research study, what we do here. They started the patient up on CBD,
Mhm.
gradually worked up until the caregiver felt that the maximum benefit was there. The caregiver was then allowed to then bring in THC individually and working that up. And then they would land on a ratio. Some would be like a ratio of 1 THC to 49 CBDs. Others could be 1 THC to 3. And so, but whatever it was that they determined was the best, they then kept them there for 3 months. And then they did follow-up questionnaires after the 3 months. And they found that 90%, so 18 of the 20 individuals show, actually 95% showed significant improvements in one of the areas. 90% said that there was an overall benefit. So a couple of one of them, even though there was a great benefit, there was some side effects that they made him say that overall it was a negative. But
Yeah.
another thing is like around 80% of the caregivers said their life, the caregiver's life, was better because, kind of as we talked about before.
Mhm, mhm. So do you think that more studies need to be done? Because you referenced that it was done in where? Not
In
the US.
Brazil, in Brazil.
Right. So what are your perspectives on, seeing more research done in the US as cannabis use is becoming more legalized in states across the
Right.
country?
It's really gonna come down to if/when the FDA changes the scheduling of cannabis, because
Mhm,
right now, because it's considered the highest level, of the schedule, they're equating it to LSD and to cocaine, which, you
mhm.
know, that's the category that's falling in. And I mean, anybody who has no anything whatsoever who can open up a textbook realize, and part of that of that level of scheduling says does not have any medical benefit, which of course, as we just presented, that's not the case. And there's lots of other studies about there. The issue that we're having in America is that part of that being a controlled substance with no benefit, people aren't allowed to just research it the way that they could Ritalin or other things like that. So we're not going to probably see much budging on that until, it is hopeful that President Biden will formally announce it, then the FDA will go ahead and change the scheduling. And I think
Mhm,
that there's a relatively good chance that that'll happen before the election. It's good politics.
mhm.
But so I think once that happens, I think that will be a game changer.
Hmm. Earlier in the show, when I was doing the introduction, I referenced that you're one of the few physicians in Florida that actually do what you do, which is, treat young kids with cannabis when they have autism. How many others across the state are in this level, have this level of expertise that
Yeah.
you have?
In terms of people who are actual pediatricians that are practicing pediatricians, I don't
Hmm.
know that there's any. There are family medicine doctors and other, because you can be an internal medicine doctor, you could be a radiologist and get the certification and treat kids.
Wow.
So, as a pediatrician who's actually doing this, and, as a person who, as a holistic functional medicine doctor, I've been using herbs in kids for 25 years. Not this herb,
Mhm.
obviously,
I
so
was
for
gonna say, what
me, yeah,
herbs?
but the thing is so, all of this time I had to figure out how to come up with dosing regimens on an individualized basis for them. So when cannabis came around, when obviously most doctors, um, whether they weren't agreeing, freaking out, or had no knowledge, I knew very well how to do titration of natural supplements in order to get to be able to help a family figure out what the right thing was. So I think I also had a really big head start on everybody.
Yeah. What kind of questions do you get from parents who are considering this kind of treatment for their children?
Yeah. Well, there's two parts. So in my main practice are just wanting to learn more to see if they should in the first place.
Yeah.
So I actually have two practices: holistic pediatrics and family care, which is my main clinic.
Mhm.
Holistic relief is dedicated just to the certifying of cannabis patients. So once a patient has already made an appointment, they kind of already know they want to start using cannabinoids.
Mhm.
But one of the things after, because a lot of people don't realize, and not just CBD, but I use a lot of CBG, George G, in my practice, which is really good for anxiety. And I
Mhm.
use a lot of CBN in my practice, which is wonderful for sleep. And of course, CBD as well. So I would say about 10 to 15% of the patients who come in to get certified, once they learn and I show them how to use the dosings for the other, they actually say, hey, you know what? I want to use the hemp derived cannabinoids, and let's hold off on actually putting in for the card and doing that. And I'll get back to you if I need the card. So I put all the documentation down. So if they want to turn it on, we can do that. But, so
Mhm.
it really depends on the individual. But a lot of parents were actually, hey, no, I'd be just as fine not putting my kid on THC if we can accomplish other things. So as a rule of thought for me, it's just like I would never tell a parent to just start their kid on THC. I'd start on the hemp-derived cannabinoids first.
Right, right. Well, we're starting to get some questions from our live audience here, and we have a question from Elias wanting to know what are the main effects of the drops? What is the main THC level of drops? How long does the effect last?
Okay, so let me ask the third one part first. So the effects typically last 4-ish hours, 6-ish hours. It is variable. Different people have different metabolism, just like with other medications.
Mhm.
In terms of the drops, so when you swallow something, so I would say that this is true for edibles or capsules. Anything that gets swallowed, once it's going down into the stomach, it then has to be absorbed in the intestines.
Mhm.
That's why it typically takes longer to kick in. So on average, it also takes about an hour to kick in. Okay. And of course, depending on now, the drops, you're going to see different milligrams per drop or milligrams per milliliter on there. So you have to be really careful what you're doing, even if you're changing from one product to the other, because you can't just assume one drop is one drop. One drop could have 1 milligram, one drop could have 2 or 3 milligrams of THC in it. So you have to know what you're doing. And in fact, I tell people, don't think in terms of drops, think in terms of milligrams to figure out what you need to do. Okay.
Mhm.
So, but in terms of that, so I mean, I have some kids who can get away with 2 or 3 milligrams, and that's all they need. I have other people who are needing 25 milligrams. One of the interesting things that I have observed though with kids with autism, even those who are taking the high doses, and even on some who aren't taking CBD with it, a lot of them they do not act high. I think it's because of that what we were talking about before, that there's this deficiency, and so I'm thinking that in people with autism, a good percentage of them, it's kind of getting them to normal, as opposed to when a person who has normal endocannabinoids and a
Yeah.
person uses it and it brings them above that. But I think that we can find the sweet spot for a lot of these kids just to fix the deficiency, if you will. So but that really have to do that. But in terms of the level, obviously we can't check blood levels for it, so you kind of have to titrate it individually.
Yeah. So what I'm hearing from you, Dr. Berger, and Dr. David, I hear it pretty clear is that if someone has autism or has a child with autism, they're interested in using medical cannabis, they really need to have a really close relationship with a qualified physician to help them determine the best approach for that child so that they can get the help that they need.
Yes, and I'll clarify that to say 'cause a knowledgeable physician, because to be qualified according to the state, you just need to take a 2-hour class that teaches you how to put patients into the registry. There's
Oh,
no requirement for the state that you have to know anything about it and be a DO or an MD. Those are the only 2 requirements to be qualified according to the state. So just to be clear, just because somebody has received that their physician certification doesn't mean they know bupkis. So
yeah.
that's important to know. So knowing somebody who does that, and that's why one of the things that I also do is I actually developed the second Dr. David MD is an educational company. So if
Mhm.
patients are too far away from me or they see another doctor but they don't have a clue what to do, a lot of people will consult with me on how to do the proper titration, how to understand terpenes, which I know we didn't get much into that yet.
Yeah.
Which companies are, I'll even do online shopping with them. I'm like, let's go to the dispensary. Like, this is the product I would recommend that you take, or I would suggest that you take. And this is when I do the education, I kind of have to use where it says this is the typical type of dosing regimen that I would use in an individual, since obviously I'm not their doctor at that point. So
Right.
I have to use a
Mhm.
little bit different wording thing, like it's things like the types of dosing that I talk about is this, so it's a little
Yeah.
different since they're not the doctor patient relationship.
So, what resources would you recommend to families or individuals who are considering cannabis as a treatment for autism? What resources do you recommend for them to look
Yeah,
into?
well, I would say, in all honesty, my YouTube channel, Dr. David MD, I do a lot of articles when it comes to cannabis, all types of things, right? I mean, do a lot of other stuff too.
Yeah.
And autism is one of my sub stories also. Leafly.com, Leafly, leafly.com is a really, really good resource for all things. There's also the Realm of Caring. I think it's therock.com or .org, Realm of Caring. They're really the people who started working with, as people who are knowledgeable in things like autism. Charlotte's Web, which was the first real CBD liquid that was available for seizures and then autism, and so they were kind of involved as with a nonprofit of helping set that up as well. So that's a really good resource.
Mhm. That's really interesting. So, I want to kind of like have you share some like what are the key takeaways for anyone that's listening to this show as far as okay, you've heard Dr. David talk about how cannabis can work. We talked a little bit about what the risk could potentially be. We talked about what the potential benefits could be. We talked about the resources. But is there anything else that you would like to share that if they're considering it, here's probably the best first step, or here's something you should be, doing to
Yeah.
before you make that decision.
Yeah. Well, certainly I would encourage research. Part of any form of a form of informed consent is that you weigh the risks versus benefits compared to the alternatives. That's the medical definition of informed consent. So of course you should know about the different options. Now, granted, I have families said to me, hey, we've been on every medication, it's not working, or the side effects are too bad. Sometimes I have families who say, I don't want to put pharmaceuticals into my kid. I much rather put a natural substance into my kid. So,
Mhm,
understand a parent needs to kind of just take a centering of themselves to see, to kind of figure out what's about that. But the nice thing about it is, like, the dose that you take works the very first time you take it, or if it's
mhm,
not enough, or whatever, or the side effect. So compared to a lot of other medications, be it like Prozac or Zoloft, where it takes weeks to know if it's even working, you can't just increase the dose rapidly. You have to take a lot of time. If you need to come off it, you have to take time to come off of it, weaning it down. One of the really good benefits of cannabis is that you know right away what you got with that dose. Even though people will find the first day, I always recommend wait 3 to 4 days before you either change dose, change products, or etc. Just because maybe your kid had a good day or a bad day, but 3 to 4 days, you should have a pretty good idea what that's doing for you. Okay, and if you need, you can use it on school days and not weekends. You can titrate the dose as you need. So that's, again, working with the physician who understands all of those nuances does make it a rather easy thing for parents to figure out. But but part of, even like when I'm talking to them, I'm talking to a family. Well, what are the main symptoms that we're dealing with? And if their main issue is my kid's not sleeping, I may be talking to them about a very heavily indica form of THC if the the CBD and the CBN didn't work. Whereas if a person's telling me, hey, I'm really focusing on and my kids' focused attention, that's really where the help is. Well, I don't want to put somebody into la la land, which is where an indigo would be. So I talk to them about, well, this is how we approach sativas. And then, but one of the also things that we do is we share with every patient what we call the terpene wheel. It's a list of all of the different terpenes. So for those who don't know, the
Mm.
other main ingredient in cannabis, besides cannabinoids, are the terpenes. In part, it's what changes the smell and the taste of it. So if you've been around it enough, you may notice that it doesn't always smell the same. Sometimes it's more floral or citrusy or skunky. So that's the terpenes at play, but also the effects. So there are certain terpenes that are better for pain, or better for focus, or better for sleep. So so a lot of what we're also doing is part of our patient education, which every patient we have a patient education room. Every single patient after their first appointment comes to our education room, works with our patient educator. That patient educator is also there to help guide them throughout the 7 months of the certification. We don't charge questions for that. Charge for that. That's part of the service that we provide. So so it's really that education. But if you don't understand the difference about terpenes, you could really send things in the wrong direction. My kid's sleeping worse. I'm like, yeah, you just gave your kid a major sativa there. That's why. So we
Right.
educate them. We make sure that doesn't happen.
Yeah. And because of your experience, like you mentioned, over 20 years of experience working with plant-based medicines, you're called on around the nation to, just provide your insights and everything. And right now we actually have a question from a Melissa asking, you referenced earlier about changes at the federal level when it comes to cannabis. Melissa's asking, how can we influence cannabis policy with research and lived experience?
Well, certainly, at this point in time, certainly legislators could go ahead and pass a bill saying to reschedule, but it ultimately that's kind of like an executive decision. So
Mhm.
pressing, I at this point it really seems that the biggest decisions at the White House. So writing letters to the White House, encouraging President Biden to facilitate his executive branch to do this is probably going to be the most helpful thing. Send pictures of your kids, send stories of your kids with autism. Nothing tugs at the heartstrings better than that. Um, and obviously the sharing, going on media, media does love to hear these types of stories. So if you're one who's had a really good success story with cannabis, they love that. From what I've been told by a news reporter, that some of the two most sought after stories are stories about kids, that people will watch, stories about kids and stories about marijuana. And so if you have a story that incorporates both, it gets considered media gold. So whether it's a doctor who's willing to go on with you, or you telling your story, obviously, about that, that's how it came to be with the patient. And I've done other patients over the time too, and I do make myself very available to media in order to get the word out as much as I can, about that. But it's just spreading the word, getting the word out. Certainly can still write to your legislators, and maybe they can put pressure on the executive branch too.
Yeah. Well, Dr. David, this was such a rich conversation. Can you share with our listeners and viewers the best way for them to contact you and learn more about the work that you're doing?
Absolutely. So my main medical practice is holistic with a W, because we look at the whole picture. Holisticfamilycare.com. The cannabis clinic is, again, holistic with a W. Relief, holistic relief, but it's RELEAF. So we played off the word leaf there. Holisticrelief.com. And then as a Dr. David MD, Dr. David MD is the YouTube channel. And then I think it's Paging Dr. David is the Paging Dr. David MD is the my call for like social media. And then I do have a Patreon page also that if people want to support the work we do to help make our educational videos and stuff, we appreciate that too.
Okay, well, I was about to wrap up, but we just got a great question from Shakonda, who's on Facebook. Let's bring that up. So, for
All
an
right.
adult that has just been diagnosed, what would you recommend the traditional pharmaceutical treatment or alternative plant-based treatment be?
Okay, so coming back to what we were saying before about the spectrum. Okay, so really it depends on what the individual symptoms are. So if a person, let's say, is having autism and irritability from a pharmaceutical perspective, then those antipsychotic medications can work very well. Whereas if their problem is AD, more attention focus issues, then the stimulant medications or non-stimulant medications, and again, anxiety, the anxiety, antidepressant types of medications. And then in terms of alternative plant-based treatment, again, I use lots of other different herbs in my practice, and other different types of supplements. I use amino acids, omega-3 fatty acids, lots of different vitamins. So, in my main practice, what I do is I check levels, a lot of those things, like vitamin D levels and zinc levels. And my point of the way I approach it is I aim to get people into the middle part of reference range. A lot of doctors don't. They just say you're in range, you're fine. So I think that that's really important. But then another big thing that we do in the functional medicine world is focusing on the intestinal microbiome. How are the good guys, the good bacteria, the flora? How are those levels? And are there any bad guys growing there? Is any inflammation? So that's kind of like the bigger picture of what we do, and that can get to a lot of the root cause issues with autism. So the way I look at it is that cannabis is not fixing the root cause, except for in that potential deficiency state. Right. Whereas, obviously all those other medications, whether stimulant medications, anxiety medications, etc., they're obviously not getting to the root cause also. But if your root cause is a vitamin D deficiency, if your root cause is that you have intestinal yeast that secretes toxins that can make the brain not function properly, you fix that, you can get to the root cause. So that's what I also like to do. So to me, cannabis, while it's a very amazing tool, it's one of the most helpful tools that I have for autism. I also want to look for the root cause.
Yeah. All right. And we got one more question we'll wrap up with. It is Elias again with another question.
All right.
Could you please provide some examples of the pharmaceutical drops that are available at pharmacies? I think drops of the THC are perfect substitutes for Xanax as well.
Okay, so there are no THC drops at pharmacies. The only place that one can get THC drops is from a state legal medical marijuana treatment center, or MMTC, or as most people call them, dispensaries. Okay, so yeah, you're not going to find it in a pharmaceutical. There is no such thing as pharmaceutical drops. The only thing that is pharmaceutical is a CBD product called Epidiolex that's been FDA approved for certain seizure disorders, and that's a high concentration particular product. But you're not going to find, there is one synthetic THC product that's used for people who have cancer and AIDS for a synthetic form of THC, but that's not something that I use.
Okay. And we have people wanting to know your contact information. So we're posting in the live comments on Facebook and YouTube the link to your website so they can find out how to contact you via phone, email, and where you're located.
Sounds great.
Okay. Well, Dr. David, thank you so much for being a guest on this conversation on Cannabis Virtual Forum, brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. Thank you to everyone watching this program. Tell us what you think about this forum by completing the survey. Post it in the comment boxes on YouTube and Facebook after this live program. If you complete the survey, your name will be entered into a drawing on May 7th, 2024 to win a $100 gift card provided by one of Mary's partners. We also want to encourage you to go to the Florida Department of Health Office of Medical Marijuana Use website to learn how to obtain a legal medical marijuana card in the state of Florida. And we also encourage you to go to Florida A&M University's Mary website to learn more about this initiative, its educational programs, and additional information about cannabis use in Florida. Thanks, everyone.